We will be answering to a few of your questions which we got in our Instagram DM or Q&A sessions. So, Namaste, I'm Dr. Alicia, a neurophysiotherapist, and I welcome you all to another video from Sakshyam Physiotherapy and Rehab. But, in this video, we are not going to teach you anything. We will be answering few of your questions which might be funny or helpful to you. So, let's start with that. So the first question that we have is, do physiotherapists secretly judge how people walk in malls? Okay, we don't judge, but yeah, we do observe. So it has become a habit. So we do notice how people walk, if their walking is even or uneven, how is the posture, if they're limping or not. So you can call it a professional hazard. Okay, that by default, we do watch people, we do observe people, and then we do discuss it among ourselves as a part of case discussion. So yes, we cannot take it out even if we are not working.
Coming to the next question is, what is the most common mistake people make after an injury? So there are two extremes. कुछ लोग होते हैं, they will start doing literally everything once they will start feeling a little better, and some people will be so scared, they will restrict every kind of movement, and the recovery lies in the middle. So at the beginning or the initial stage, we have to give our body a bit of rest, but gradually and safely we have to improvise our movements.
And the next question is, do physiotherapists ever get back pain themselves? Yes, why not? We too are humans. हमको भी दर्द होता है पेशेंट्स के साथ. If you'll ask about me, न्यूरो फिजियोथेरेपिस्ट हूँ, तो मुझे पेशेंट्स के साथ खड़ा होना पड़ता है उनके ट्रीटमेंट के टाइम पे, उनको वॉक कराने के टाइम पे, एंड उनका समटाइम्स आई हैव टू टेक द वेट आल्सो बिकॉज आई डू मोस्टली डील विद पैरालिसिस पेशेंट्स, सो दे कैन नॉट वॉक ऑन देयर ओन, सो आई हैव टू हेल्प देम. सो ऐसे करते करते बैक पेन्स भी होते हैं, लेग पेन भी होता है, बट द ओनली डिफरेंस बिटवीन यू एंड मी इज मुझे पता है कि मुझे पेन क्यों हो रहा है, पेन कहाँ से आ रहा है, एंड हाउ टू मैनेज इट. दैट्स द ओनली डिफरेंस.
Coming to the next question, can I continue going to the gym while taking physiotherapy? In many cases, yes, and sometimes we even encourage people to go to gym and stay active while continuing the physiotherapy sessions. But you may need to add some of the stretches or some of the exercises to your workout routine for a while, and you may need to reduce some of the exercises also. Because the goal is not to stop exercising, the goal is to improve your exercise so that it will help in the recovery.
Okay, so coming to the next question, which we have is, what's one thing that annoys every physiotherapist? So, well, there are a lot of things that annoys physiotherapists, but I'm gonna answer about the most common thing. So, I think most of the physiotherapists will agree with me on this, that when we ask the patients that have you been doing all the home exercises या फिर क्या क्या exercises किए हैं आपने, तो वो पूरा confidently बोलते हैं कि हाँ हमने सारे exercises कर लिए हैं and सब अच्छे से किया है. And when we ask them to demonstrate one to check if that is they are doing it correctly or not, फिर suddenly उनका ऐसा होता है ना कि अरे ये था क्या, हम भूल गए, पता नहीं क्या क्या था, ऐसे होता है. And I want to answer to one second most irritating thing is being inconsistent. आप उनसे 1000 बारी ही क्यों ना बोल लो कि ये आपके लिए अच्छा है, ये आपके लिए सही है, this will help you recover, but फिर भी वो नहीं आएंगे. They will not be consistent with their exercises. So yeah, these two are the most irritating thing if you'll ask me.
The next question is, why do some people recover in 2 weeks while others take months? Okay, recovery is not just about the person or the patient. Recovery is about their respective age group, their sleep quality, their nutrition, their overall health, and if they have any other underlying medical conditions. And the most important part is how consistent they are with their physiotherapy or the rehab sessions. So that is why two people with the same diagnosis can recover at different speeds.
Coming to the next question, is pain always a bad sign? So no, pain is not always a bad sign. It's your body's way of letting you know that something is off or something is new. So pain doesn't always mean a serious condition. For example, if you are just starting with your gym exercises, then it's very common that you'll get muscle soreness. So that is your body's way of letting you know that something new is going on with your body. And that is not serious, that will subside within few days. But at the same time, if you are getting a persistent pain for a period of time, let's say 10 days, 15 days, and it's not subsiding, then you should not avoid that. You should consult a physio or a doctor as soon as possible.
Coming to the last question for today, which daily habit is silently damaging our bodies the most? If I had to pick one in today's scenario, that would be sitting without breaks. Sitting is the new smoking. Why we say this? Because if I sitting for longer time period, doesn't matter if I sitting for your job or study or if I driving, so we are causing the tightness of the muscles, and if the muscles will get tight, that will restrict the blood flow, and that can lead to various conditions, because our body has been designed to move, never to sit without the breaks. So even getting up and moving for a couple of minutes in every 30 to 60 minutes can make a real difference. That's all for today, and we will be answering some of more questions in another video. And keep following us for more physiotherapy and health related updates.